In one of my previous roles as an applied research scientist for a large health plan, I explored many applications of deep learning that use their data in search of one that provided the greatest impact to their business while also improving the health and lives of the members we serve. And we quickly discovered a natural fit for deep learning predictive models in transforming the care management selective process. Matching members to care management programs is really a perfect use case for predictive models. After all, the goal of care management is to avoid preventable outcomes. And this selection process requires that we focus the limited resources, that being the nurses and care managers that are good at preventing these outcomes, on only those people who are truly heading for these events, such as hospital readmissions after an inpatient stay or preventable surgeries and hospitalizations. And, as I said before, the pattern for learning, pattern in the data for predicting these things are really complex, which makes the deep learning models well suited for this task. And we found that this increased accuracy can be used in a couple of different ways. One case is you can identify a more targeted list of patients or members who are in need of this intervention. And sometimes that reduction in the outreach size can be quite dramatic. And so you can reduce the number of members that you outreach while still having the same impact with respect to the metric of preventing readmissions or preventing avoidable hospitalizations, with much less resources expended. Another way you can use this increased accuracy is that you can outreach to the same number of members. And as a result of its increased ability to predict people heading for these events, the deep learning model will select for you a cohort of people to outreach that have many more impactable members in it. And so you can have a dramatic increase in the effectiveness and the results of the care management outreach. And that was what we found in practice, and that spawned a whole library of deep learning models to predict various outcomes that were preventable and to great effect. It's important to take a second and also talk about some of the unexpected benefits of doing things this way. The people doing the work of outreaching to the people, their satisfaction is greatly increased because they're doing more of the work that they came to do, and they're seeing a much larger impact, which is hard to ignore. How important it is to keep these people happy and doing the job that they do so well. Another way that you can use this increased accuracy is by moving further back in the disease progression. So we can identify, using deep learning models, members who are just beginning to have a worsening of their chronic disease and are still in what we like to call this ounce of prevention phase, where a small intervention or a light touch outreach, a behavioral nudge in a particular direction can reap huge benefits in slowing the progression of a disease and consequently the total cost of that person's care. Whereas with traditional models, many times they have to wait for an event to occur, a hospitalization, or before they can select the member for outreach. And by that time, the disease is too far gone, and we're well out of the ounce of prevention and more into the pound or more of cure phase, which costs more and has worse consequences for that person's health. So those are two ways you can use these deep learning models to not only, the increased accuracy to improve your effectiveness, or to enable lighter touch interventions earlier in the disease process, and have them be more impactful.